This is a relatively new certification in the field of medicine. We're realizing now that obesity is really a disease state, just like hypertension, just like diabetes, just like dyslipidemia. So we have to treat it as such. Unfortunately, with this rising epidemic, we're realizing we don't have the knowledge or the tools to treat this disease. That's why the ABOM came up with this new society, basically studying this disease state a little bit more. And right now there's less than 1,000 physicians in North America with a certification. And what we do is that we learn that obesity is a multifactorial disease state. There's a genetics involved, there's environmental issues involved, and we need to address them accordingly. So we learn about this, and we also learn how can we approach it at all these different angles in order to give the best care and treatment to our patients. According to the American Medical Association a couple of years back, they did say that obesity was a chronic disease state. Insurance companies are starting to catch on this as well, and they're starting to pay for obesity medicine counseling, but it is a disease state. Many times we just think it's the calories in equals calories out, but it turns out that there are some issues in the hypothalamus, the region of the brain that regulates satiety, and you may have a better set point than somebody else. Somebody may have a higher set point, hence even if they eat, they're still hungry. So sometimes these patients do need medication to help regulate those satiety signals. There has been a lot of data out there on these different diets. For example, in the future, we'll be able to determine based on the person's genetics if they'll be they'll be more responsive to a high protein, low carb diet or just an overall low calorie diet. In my personal experience, I've noticed that men tend to do better with an overall low calorie diet, whereas women are a little bit more complicated in that sense, especially with the years. If they're going through menopause, they become more sensitive to carbohydrate intake. So my overall take for women is try to decrease the carbs, increase the protein intake. I tell the same for men, but I feel that women tend to benefit from that a little bit more. Teenage years, you really want a well-balanced diet. So fats are not the worst. It just depends on the source of fat they're obtaining. But again, everybody can benefit from increasing the portions of vegetables they're taking in. Fruits are great because they're rich in antioxidants, but it depends which fruits. In a person who's, let's say, already a diabetic, they should decrease their fruit intake. Many times we have this notion that fruits are natural, they're great. It depends. If you have diabetes, then maybe that's not the best option for you. But vegetables are great. Low-fat proteins, so your poultry, low-fat red meats are fine, sardines, tuna, or vegetable-based proteins, those are also okay. Well, the study was in regards to polysorbate 80 and carboxymethyl cellulose. Those are two emulsifiers, and those are the ones they gave rats. And they realized that it caused a change in the gut flora, thus leading to inflammation. Right now, there's a lot of data out there saying that changes in the gut flora or gut bacteria can lead to obesity. So this may be one possible mechanism. Again, more of a reason to stay away from processed foods. Definitely. Obesity, unfortunately, because of its portrayal in the media, has been a very difficult topic for both the physician and the patient to address. And finding the right term to use. Many physicians are scared of offending their patients, so they just don't bring the issue up. I feel that changing the term from obesity to saying, well, you have an unhealthy weight or your BMI, which is your body mass index, lies in an unhealthy range. Let's talk about this. Maybe that's a better approach that we can use. And also letting the patient know that this is not your fault, okay? This is a disease and we want to work together to take care of it. If a person, for example, has hypertension, we'll tell them, okay, have a low sodium diet. But if they don't bring down their blood pressure, we treat. The same thing with diabetes. Your sugars are high because you have a poor diet. Yet if you can't change that, we treat the diabetes. However, the obesity, we don't. And obesity in itself is a disability at times for the patient and causes a lot of social distress. So we tell them lose weight. If they don't reach that, we just leave it and don't pursue the issue further. So I believe that we definitely need to present it as such, which is it is a multifactorial complex disease state that needs to be treated. Not anytime soon, unfortunately. It has right now 2/3 of the population is either overweight or obese, according to body mass index. Definitely, there's more. I think that there's more awareness of this. We've been trying to cut back on the fast food chains. For example, we're trying to help increase activity levels in the peds population, the pediatric population. So there's definitely more awareness. However, the lifestyles that we lead, the sedentary lifestyles, more technology, more desk jobs, for example, those make it a little bit harder for us to really promote activity and promote healthy eating. So I know there's more awareness, but I don't see the epidemic disappearing anytime soon.